This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
For most couples, the dream has always been to start a family and have a baby. But unfortunately, the road to parenthood can sometimes take longer than usual. And for some, that highly anticipated event may never arrive at all.
This is after the 1 year, may time duration po siya na after an unprotected sex, no, the woman failed to conceive is defined as infertility. No.
In the Philippines, it is estimated that 1 in 10 Filipino couples have infertility problems, based on a survey commissioned by a leading pharmaceutical group.
Common causes of infertility, so multifactorial po siya. From the woman, from the man, of course the combination and heredity and the environmental exposure.
Coping with infertility can be emotionally frustrating. But with the right diagnosis, treatment plan and support from specialists and most especially your partner, you can make informed choices and later on gain that confidence and sense of control of your life. What causes infertility in women? How can infertility have an impact on your life? What are the treatment options available? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Maria Asuncion Fernandez, an OB-gynecologist and an active consultant on the reproductive endocrinology and infertility section of the St. Luke's Medical Center. Also joining us tonight is Dr. Angela Sison Aguilar, an OB-gynecologist from the Cardinal Santos Medical Center and the president-elect of the Philippine Society for Gynecologic Endoscopy. She's also an associate professor of the OB-Gyne department of the UPPGH. Both our doctors tonight are a fellow of the Philippine Society of Reproductive Endocrinology and Infertility. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening, Angel.
Good evening, Angel.
It's Infertility Month, and tonight we will learn more about infertility, the causes, the symptoms, and how to be emotionally prepared, not just for the individual, but as well for the entire family and their partner. So doctors, let's start off by understanding what is infertility and what causes infertility. Dr. Aguilar?
Well, that's what Dr. Albert Diaz in the BTR said, that in a year's time, most couples should have conceived. That's about 80%. But beyond a year of regular unprotected sex, and if they still fail to conceive, we already define that as infertility. And we encourage the couple to seek consult with specialists so that they'll be able to receive assistance.
Mm-hmm. It has been considered already as a disease of the reproductive tract, so that it should be treated and it needs evaluation and early diagnosis.
Is this a common problem in the country?
Well, it's not really common because we are a very fertile population. You know,
We've
we
reached
just
our
100 millionth baby.
Yes.
So for our demographic, we have very young couples, very young women entering their reproductive years, and they're very, very fertile. And without any form of contraception, they conceive easily. It is different in other developed countries where they tend to postpone their childbirth, and by the time they're ready, because of age, then they may encounter all sorts of problems with regard to fertility, and they will have a longer time to conceive. So here, maybe not as common as in other countries.
You mentioned young couples and age. Is there an ideal age or the best age for a woman to conceive?
Well, it has been considered that during the early 20s is actually the best time to try conceiving, because as we advance in age, the chances of us being able to succeed in conceiving would be lower. Did you know that it's interesting to find out that as early as when we were 5 months already in the womb of our mom, that's for women or for females, we have about 6 to 7 million of primordial follicles. These are the would-be eggs that could be used for to be met by the sperm. But during birth, this has already gone down to about 1 to 2 million. And at puberty, approximately 450,000 would be left. And by the time we reach downtime at 37 years of age, it would become lower, and close to menopause, we will only be having about 25,000 or 50,000 of that available for fertilization.
The numbers really drop, not to mention the quality. The quality of eggs of a woman would suffer a significant change after the age of 35. But that's not a magic number, you know, it's not an absolute cliff that you fall off from. But they say that the trend starts at the age of 35, but for some women with some health problems or with, say, bad habits like smoking, that quality of the egg will further decrease or will deteriorate earlier than that age of 35.
So we talk of the woman and her health concerns, her age, the quality of her eggs. Is infertility just a woman's problem?
That's not true, because when we talk of infertility, the patient is not just the woman, but not just the man as well. We talk of the couple as being the patient, so that both should be evaluated to find out what is the cause of their infertility.
So men can also be diagnosed to be infertile?
Yes, 40%, as high as 40% of couples who seek help for fertility concerns will have some amount of male factor problems, so that it is important that the couple face us so that we can assist both of them. Some will have a combination of factors, not just female, but likewise male. So the approach will also be combined, not just for the female, because sometimes they would say, female first, and then when we are done with everything, we've had all sorts of tests with the female, then we turn to the male. When it turns out that it was primarily the male problem. So what a waste of time and resources if we had seen the couple earlier, as a couple, that is.
So it's suggested really that the couple be seen together.
That's
not
right.
to single out the woman or the man.
That's
right.
correct.
What causes infertility in a woman? Let's talk about the causes.
Well, a third or 25% to 30% is due to ovulatory dysfunction. That means that the woman does not regularly ovulate or put out eggs. A regular menstrual cycle will reveal that a woman may be ovulating once a month. Okay, so they have 12 chances a year to get pregnant. For some women, that regular ovulation is not present. Some won't even have any period or any ovulation at all for as long as 6 months or even a year. So ovulation should be evaluated in a woman. We can do that by doing an ultrasound. We can do that by checking hormones, and we can give solutions for that.
This is for the women. You'd like to add something to that,
Yes,
Dr.
part of
Fernandez?
the problems among women would also involve the tubal factor. And infections, like sexually transmitted infections, could actually cause blockage or obstruction of the fallopian tube. So it is imperative that the fallopian tubes, particularly the distal portion, which we call the fimbriae, it should be healthy to be able to catch the egg when it is released during ovulation. So if the block is distal, any form of ovulation would not count because the fertilization occurs in the fallopian tube in a natural cycle.
And given all these factors, we've mentioned also the age and a certain lifestyle that a woman has will contribute to infertility. Isn't that correct?
That's right. That's right. So prevention is also a very big thing. Dr. Fernandez mentioned about sexually transmitted infection. So we'd like to tell young women to please be very, very careful so that diseases such as chlamydia and gonorrhea, those are the common infections that would affect the fallopian tubes, and they may damage it permanently or scar it permanently. It will result in a block, and it will prevent them from conceiving. So they should avoid behavior that will predispose them to such. Okay? With regards to ovulation, some lifestyle factors may affect it as well. Extreme dieting may actually cause or affect ovulation adversely. So sometimes they think being very thin is desirable. That means that if they have too low a body weight, then it may affect ovulation. On the other hand, the extreme, having a lot of body fat or being very overweight may also affect ovulation. So you have to have a healthy lifestyle to have a healthy reproductive system.
A good balance of your diet, your lifestyle, your mental and your physical well-being as well. Doctors will just go to a quick break. We'll talk more about infertility when MedTalk returns.
Did you know that a diet consisting of high saturated fat can reduce your sperm count? In a study led by Professor Jill Ataman of Harvard Medical School in Boston, it was revealed that those eating junk food diets had poorer sperm quality.
We're back here on MedTalk, still talking about infertility. You may join the discussion by calling our hotline at 548-4678. Now, doctors, let's talk about the myths surrounding infertility. Myth number one, couples who, quote-unquote, work hard enough at having a baby will eventually get pregnant.
Well, we want couples to have a healthy sex life. You know, I don't know what the hard enough means, but we want them to have regular intercourse, defined as
Every 2 to 3 days at the minimum of intercourse, or at least, so that's approximately 3 to 4 times a week. Strictly speaking, it's not. It can be allowed to do it every day if you want, or every other day, but never go beyond 3 days of abstinence if you really want to get pregnant.
The myth there is that women ask their partners to abstain, to save up for the time that they're fertile. That's a myth. We want them to just go ahead and have a very healthy life and just have regular intercourse, because if you fail to have any ejaculation for more than 10 days, that may actually cause the sperm to spoil. Okay, we have free radical damage to the sperm, there's oxidative stress. So when you put it out regularly, like they say, you have to use it, otherwise you will lose it.
Okay.
So that's a healthy sex life, and we want them to work at a regular pace in that sense.
Okay, thank you, doctors. Myth number two, infertility is due to physiological or psychological or relationship problems, not physical ones.
Well, that's possible because sometimes people think that when you're too stressed or if you don't have time to do it, or stress in itself would limit or lower the libido of the couple. So that if this would be limited, then there is lesser chances of really doing the intercourse, and you will have lesser percentage of the pregnancy. Now, some couples would actually, if it has to be a couple's decision, sometimes only one would like to have the pregnancy and the other one is pushed into trying to get involved when he's not or she's not really ready yet for the pregnancy. So it causes marital instability. It causes some feeling of guilt, or the woman would feel not beautiful because the husband may not seem to cooperate in her desire to have a baby soon.
Well, definitely sexual or psychological dysfunction can cause infertility, but they have to be evaluated first because there may be some true physical basis for infertility, like what we said, the ovulation, the male factor sperm problems, the fallopian tube problems. But sexual dysfunction indeed can play a role, and there, among the sexual dysfunctions that we may encounter are, for example, in the male, there could be impotence, premature ejaculation. Also, for the female, there may be what we call the vaginismus, where the male organ cannot be inserted in the female because of very involuntary muscle spasm. So these are not just physical, but issues that may have a psychological basis as well, and we have to evaluate that to be able to help the couple.
If the couple is having a situation like this, it is best to consult their gynecologist.
Definitely.
Okay, and not try to solve it on their own. You said?
Yeah. Tell them not to Google it and try to
okay.
work out a solution based on what they read on the internet, because they may need professional help.
That's right. And sometimes upon the diagnosis, there might be an underlying health concern.
That's
once
right.
they are checked.
Yes. In fact, some patients have, well, for males, diabetes may cause impotence or problems with ejaculation. So they don't discover it until they are having the sexual dysfunction.
Some medicines could also affect their ability to have erection, or like antihypertensive drugs can affect that. And it has to be discussed also, and if they are given medications, they should be instructed as to what complications to watch out for when they're given other medications.
Okay. Thank you, Dr. Smith. Number 3, fertility problems only begin after a certain age.
Well, many couples usually consult us when they're already in their ripe 30s. Okay. That's the demographic that we have in the Philippines. But interestingly, there are a certain group of couples that get married early but find it quite mysterious that they're unable to conceive. When we go into workup, then we discover many things. We have patients whose husbands have a sperm count of 0, but they're very young. We have women who don't have any ovulation. We have occasionally a patient who came to us with no uterus. Okay, that's a very rare congenital abnormality. So even with a young age, then if they feel they've done enough effort to conceive and they still are not reaching their goal, then a consultation at the earliest stage will be warranted.
And
some chromosomal abnormalities also may present as female phenotypically, but when you try to find out, then you would notice in their tests that they have actually a Y chromosome, which prevents them also from getting pregnant.
And you mentioned, Dr. Aguilar, enough effort. Myth number 1 was working hard at it, and before we began the program, we mentioned about 6 months to a year of trying to conceive is when they should consult.
That's right.
Okay. Dr. Smith, number 4, only individuals with unhealthy lifestyles experience infertility. So let's first define an unhealthy lifestyle. We've mentioned being too thin or a little bit on the healthier
weight
side.
challenged.
Weight challenged, yes.
Alright.
Smoking, does it
Yes.
contribute?
Yes.
Smoking can both affect the female and the male, and most of the time it's the female who gets affected because smoking can actually produce substances that can be found in the follicular fluid of the woman. It can also thicken the zona pellucida, that's the outer covering of the egg. And all of this can have effects in the ovulation of the female. And also, it has a direct mutagenic effect on the oocytes. And some patients would even end up having an early menopause because of smoking. So for men, the studies would actually be unclear as to its direct effect. But sperm motility, particularly the progressive motility, is affected with smoking.
Okay.
We would usually advise men to stop smoking, and if ever it's not going to help them with the fertility, at least we know that we have helped them in their general health.
Okay, so smoking,
Well, some occupations may expose couples, especially males, unnecessarily to environmental toxins. We've seen this in some areas of the country where, for example, mining, pesticides have negative impact on sperm. Okay, also heat. Some professions will have a predisposition to exposure to unnecessarily high heat. You know, the testicle was constructed to hang outside the body because it has to be there because the temperatures outside the body are lower. Okay, so if you expose the male to a high heat environment, and what are these occupations? Patients or males who are cooks, males who are probably sailors or seamen who work in the boiler room of a ship, and they will work there months on end. They say sometimes truck drivers who are sitting on the hot engines of their vehicles for a long period of time, they have some amount of destruction of the sperm or inability of the sperm to function well. So what happens is that they will take some time to recover. Hopefully it's not permanent before they're able to have enough sperm to conceive, to allow their wives to conceive again.
How about sports activities? Are there certain sports activities that should be lessened when a couple is trying to conceive?
That's kind of difficult to determine, especially when you say what kind of sports activities. But what should be put into mind is that extreme sports, like for females, especially those who are runners, those who are in heavy training, this can actually prevent them from menstruating. So if they don't menstruate, it means that they are not regularly or not at all ovulating.
Okay. Thank you, doctors. We move on to myth number 5. If you have had children previously, you won't suffer from infertility later on.
Well, there's such a thing as secondary infertility. So patients may have an easy time conceiving the first time around, and they say that, oh, we've done it before, we'll postpone the next one. Sometimes it takes a decade before they're trying for their next one. Then the age factor sets in, and that is very significant. Also, there may be some issues with regards to their lifestyle that will catch up on them. They start smoking heavily, and eventually their reproductive potential is negatively affected. Some patients also would have ovulatory problems that are aggravated over time. So also with sperm damage, okay, your occupational hazards, your toxins may catch up with the husband, and eventually the sperm quality will deteriorate over time.
I think it has to do with the timing to conceive after the first pregnancy. So if you decide to get pregnant soon enough, then the chances should be better compared to a woman of the same age and who is trying for the first time. So for these women, if you decide to postpone the conception, by age, we also start to develop other conditions related to the reproductive tract, which would be endometriosis, adenomyosis, and we have progression of this, which could probably affect fertility.
You've mentioned endometriosis and other health problems that may arise because of age and a certain lifestyle when trying to conceive. We'll talk more about that, and of course we'll talk about the health concerns as well of the male, because it's a couple. When you're trying to conceive, you're always a couple, and when you have health concerns, it's brought about by two individuals. So we'll talk more about that. We'll talk more about infertility when MedTalk returns. We're back here on MedTalk, still talking about infertility. You may join the discussion by calling our hotline at 548-4678. Now, doctors, let's talk about the possible health problems brought about by infertility. Let's start off with endometriosis. What is endometriosis?
Well, endometriosis is a chronic and progressive disease that deals with the condition where the lining of the uterus backflows into the abdominal cavity through the fallopian tube. So when those cells from the uterine lining called endometrium goes into the abdominal cavity, they implant there. And they seed and implant, and they may grow, causing cysts in the ovary, causing fibrosis or scarring of the fallopian tubes, and causing inflammation or a negative environment for the egg as well as the ovulated egg as well as the embryo to exist. So there are many negative effects of endometriosis infertility. And while it is progressive, we may keep it at bay if we hormonally suppress the woman until she is ready to conceive. But when the woman is diagnosed with endometriosis, then she should reconsider her reproductive goals, maybe shift the timetable to an earlier date with regard starting a family, because the disease is indeed progressive, and we have to make sure that her reproductive potential is realized before the disease takes its toll on her reproductive tract.
Will this disease manifest in other ways aside from infertility, being unable to conceive?
Yes.
The usual presentation is pain, and some patients would actually complain of dysmenorrhea or painful menstruation. And the cause of this is because if you have implants, the inner lining of the uterus contain glands and stroma, which are supposed to bleed each time you have your menses. So these implants, when located outside of the uterus, that's what we call endometriosis. So they behave in a similar manner as those that are within the uterus. So when you have the menstrual cycle, these implants would bleed and can cause chemical irritation in the pelvic cavity. So that causes the pain. Sometimes if it involves the ovary, then it can appear as cysts, and patients would complain of pelvic heaviness in a certain area that is affected. The second most common location of endometriosis is the back of the uterus, or we call it the cul-de-sac. The uterus sacrals, these are ligaments at the back portion of the uterus or lower part of it, can actually have adhesions into the intestines, the rectosigmoid portion, so that some patients would present as having diarrhea or constipation on their day of menses. So aside, so most of the time it's pain or this, it is described as a woman who is in severe pain.
But sometimes dysmenorrhea in your teenage years is normal, is common. So how do we differentiate? Yes.
So there's the diagnosis of primary dysmenorrhea, but we have to make sure that the primary dysmenorrhea is not debilitating. Otherwise, the adolescent may have very functional disturbances. They may not be able to go to school to function properly. Okay, so they should be evaluated if the dysmenorrhea is severe enough. Otherwise, we may be missing out on the diagnosis of endometriosis. She may already have a big cyst there, or she may have the disease, the beginning of the disease, and if we fail to identify it, because of the stigma of a young woman or an adolescent going to the gynecologist, then we may lose out on an early type of intervention, and it may prevent her from getting pregnant in the future if we fail to see and intervene at an early phase.
Once someone has been diagnosed with endometriosis, what is the next step? What are the treatment options available?
Well, it actually depends upon the concern of the patient. If it's pain, then we can treat medically. But if it is not relieved by the medical treatment, then we have an option for surgery. The gold standard for diagnosis of endometriosis is laparoscopy, which is a minimally invasive procedure where we get a direct visualization of the implants. And with this minimally invasive procedure, we are able to not just see but treat the implants by excising this. If it's a cyst, then we remove the cyst and its content. But of course, with care, not to remove the normal ovarian tissues when we do so.
And with this procedure, how long after can the woman
They should
try?
conceive right away, because after the surgery, it is presumed that any visible lesions have been removed, and this has optimized the woman's ability to conceive. So rather than wait, then they should go and have active intervention to help them conceive, because otherwise, being progressive, then the endometriosis might regrow again.
The chance also of getting pregnant within the first 6 months is actually 65%. So it goes lower when you postpone the chances or your efforts of getting pregnant.
Now, another health concern is polycystic ovary syndrome. What exactly is POS, Dr. Fernandez?
PCO
PCO,
has to be differentiated from PCOS, because polycystic ovary is an ultrasound finding only describing an ovary with follicles that are greater than 12 in number. They have cystic or small follicles more than 12 in number, but less than 1 centimeter by measurement. That's it. But when you say polycystic ovary syndrome, you have to be able to meet at least 2 out of the 3 criteria to diagnose PCOS. And that includes chronic anovulation, meaning the woman may either have no menses or very infrequent menses. So the second would be clinical or biochemical signs of hyperandrogenism. So women would have some percentage of the androgens, but when they are overexpressed, then you can have a woman with midline hair, meaning they could have mustache, a beard, hair on the chest, around the nipple, and even the pubic hair distribution is actually different. You can have hairs going up to the navel. And the third would be the classic picture of PCO by ultrasound. So if you have any 2 of this, then you can have PCOS.
Okay. Doctors, we have a caller on the line. Good evening, Lynn.
Yes, good evening.
Hi, good evening. Your question for our doctors.
Yes, good evening. Yes, the question ko lang po is, I was married when I was 18 years old. At nag-family planning ako for 5 years. 3 years for pills and like 3 years for injectable and 2 years for pills. Is going to like in
Lynn?
huh?
Lynn, yeah. Medyo garbled what you're saying. If you don't mind, pwedeng pakiulit lang yung question.
Okay.
Salamat.
Gusto lang po kasi I'm getting married when I was 8 years old. Nag-family planning ako 5 years.
Okay. Okay, we'll talk to Lynn again in a while. Apologies for that. All right, we were talking about
polycystic
ovary syndrome. These cysts, are they taken out or do they just remain and you have oral medication for it to go away?
The polycystic ovary syndrome is the most common endocrinopathy affecting women of reproductive age. In fact, you can have almost 10 to 20% incidence in the general population at large. So if we're teaching in a class and the class contains 20 females, we ask them, how many of you do you have irregular menses? At least 1 or 2 will raise their hands. So when they look at them on ultrasound, the ovary would appear to have many spaces appearing as black on ultrasound. So these are termed the cysts because they look like spaces. Cyst meaning the Greek word for spaces. Okay, so poly meaning many and cyst meaning space. So these are not pathological cysts. They are not cancer. They're actually the follicles or the shell of the egg that is supposed to grow every time a woman ovulates. But since they do not ovulate, they remain immature. Then they crowd the ovary with plenty of follicles appearing to have that polycystic look on ultrasound. You don't take them out, you just have to help them ovulate or reach maturity when you're trying to help the patient conceive.
And you'd like to add something, Doc?
This is actually a health concern because even if you don't do surgery on them, once you are a PCOS, you are always a PCOS. And knowing it at an early time would help you prevent the complications related to it. So aside from the infertility because of irregular cycles, one can actually develop diabetes because of the insulin resistance related to this one. You can have metabolic syndrome when you start having hypertension and if it's related to obesity. This can actually turn into coronary heart disease in the future. And because these women do not regularly ovulate, they may not have their periods for over 3 months, it gives them a risk for developing hyperplasia of the endometrium or even cancer at that.
So it's really best that if you feel something in your body that is not right, most especially when we have our monthly cycle, no?
So when we're dealing with adolescents, when they have severe pain or their menses do not become regular after 2 to 3 years from the start of their periods, they should seek consult because many of these, sequelae of endometriosis as well as polycystic ovary syndrome can be prevented at an early phase. They don't have to suffer, say, diabetes in later life if they know that they're genetically predisposed for it.
And they don't have to suffer emotionally if they want to conceive and
That's
they did
right.
not address it at their younger age.
That's right.
Doctors will talk more about infertility when MedTalk returns.
According to a study that appeared in the American Journal of Obstetrics and Gynecology, sperm concentration and their ability to move around lower significantly during summer, spring, and fall. This means that human sperm are generally healthier during winter and early spring.
We're back here on MedTalk, still talking about infertility. We had a caller on the line earlier, doctor. Her name is Lynn, and her question is, she had family planning for 5 years. She took pills and injectables. Now she's having a hard time to conceive. What could be the reason?
Well, she should get evaluated for ovulation because there might have been a prolonged suppression of her ovulation from the DMPA or the injectable. And then also evaluate again the partner. Go back to the partner. Maybe the partner had some issues with regards sperm quality that has to be evaluated. But definitely she should go and see a doctor.
Is 5 years a long time to be on a pill or to have to take advantage of the injectable so you don't get pregnant right away?
It actually depends upon the age of the patient when she decides to get pregnant again, but 5 years is okay.
It's okay. It's always, you always mention the age of the patient, whether it be the female or the male. Age does really play a big role,
That's right.
a big part in conceiving and in being diagnosed to be infertile, no, doctors?
That's right, that's right.
Going back to that
Yes, doctor.
patient, we can actually ask her to find out or at least observe if she would get her menses back after the either 70th day from the last injection, and maybe she could get her period. Well, if she doesn't, then she has to consult the doctor.
Okay. So I'm sure Lynn is watching at the moment, so I hope we answered her question. Doctors, the treatment options available for women trying to conceive. Dr. Aguilar.
Well, the first line that we can give is trying to monitor their ovulation, whether it's a natural ovulation or ovulation induced by medication. We can give many drugs, including clomiphene or injectables like gonadotropins, and then we monitor their response by ultrasound. When the ovulation is imminent, then we advise the couple to have intercourse at a specific time, and we also may ask them to do intrauterine insemination if such assistance is required, for example, for mild male problems. We have to also evaluate the fallopian tubes as well.
You mentioned intrauterine insemination. Let's talk more about that. It's a form of artificial insemination, is that correct?
Yes.
So let's talk more about that, doctors.
Artificial insemination could either be by the husband or by a donor, but of course in the Philippines we don't have donation. So anyway, it is a method by which we process the sperm or wash it so that it would be prepared to be placed closer into the uterus, so that it has to travel, or you shorten the distance of the sperm to get into the fallopian tube for fertilization of the egg. So for conditions like male factors where the sperm parameters are not within the acceptable limits, then you can do insemination. Some patients who have tried naturally for a long time and they seem to have unexplained infertility, meaning all the results of the tube, the semen analysis, or even the ovulation, these are all normal, but they just don't get pregnant right away, then you can recommend AI or IUI.
How soon after the recommendation of AI or IUI can the couple get pregnant?
Well, within the course of insemination, we usually have increasing our pregnancy rates, cumulative pregnancy rates increase over time, and it will peak after the third cycle. After the third cycle, they will say that the chance of pregnancy may plateau, meaning beyond the third or fourth try, you will not really improve the pregnancy rates by repeating the same method. So the couple will have to discuss with their physician what other options will be available to assist their fertility. They may proceed with other procedures such as doing a hysteroscopy to check if there are polyps, or maybe proceed with an in vitro fertilization, which is the next assisted reproductive technique that we have available here in the Philippines.
So we have IVF here in the Philippines. Let's talk about this other option in conceiving. Dr. Aguilar.
Yes, IVF is a procedure where this fertilization is done outside the body, hence in vitro. The eggs are obtained from the woman after stimulation by drugs is applied. It is done through ultrasound guidance, and the eggs are fertilized in the laboratory using either fresh ejaculated sperm or frozen sperm. These may be obtained from the ejaculate or directly from the testicle by procedures that are utilized, where we do that in the lab too. So when the egg is injected with the sperm or incubated with sperm, the following day we see an embryo forming. That means the egg is fertilized, and we wait for 2 to 3 days. And sometimes if we have very healthy embryos, we extend the culture for about 5 days before the embryos are replaced back inside the uterus. Okay, so that's the embryo transfer phase of the in vitro fertilization. So our chances of success will be around about 30 to 40% on the average across all ages and across all causes of infertility. But if you just have pure male factor infertility and you have a very young woman, then the chances can be as high as 50, even 60%.
How will the couple determine, or how will they choose which service they should get in order to conceive?
Actually, we should tell the patients that IVF is not the last option. It is one of the options. So this, of course, we would usually consider the female history if an age is very important. So if she is less than 40, then she can try the all natural or IUI or even ART. But if she is anovulatory, she can just be given fertility drugs and can try any of these 3 services. If there is fallopian tube blockage, and most of the time it's the proximal or the inner portion of the fallopian tube which is affected, then IVF is really the only answer to that. But for male concerns, if the values are normal, then any of the 3 services can be done. But if it is low and or absent, where we need to extract the sperm from the epididymis or the directly from the testicles, then maybe the IVF is the only option also for them.
Is IVF expensive?
Well, the medications may be quite costly, and the procedure, because it's highly interventional, will have some amount of cost. But our local costs are comparable with the region, and even cheaper than, say, if you've had a procedure done in the United States.
So we do have IVF here.
Yes, we have IVF.
And the success rate of IVF in the country?
We're comparable. We have 5 centers across the Philippines, 4 in Metro Manila and 1 in Cebu. And we have very good success rates. So we can say that we are at par with the international rates that are expected of us.
Are there any support groups for those couples trying to conceive and having difficulty?
Well, for now, we don't have a specific support group except for those patients who would come to each other for comfort, or only when they find out through internet, or most of the time these are couples who would find themselves together while doing the procedure. But we hope to have more of that, especially in our country, because it is, the infertility problem is really very, very sensitive, and not everyone would like to talk about it.
Yes.
That's right. That's why I'd like to encourage couples to reach out. Okay, don't be stymied by the social stigma of infertility, because it is not just it's not just the problem of lack of having children per se, but it might reveal an underlying medical problem. And unless they seek the help of a physician, then we will not be able to discover what needs to be discovered anyway in the first place. So there are many specialists all over the country. We have from Region 2 down up till Davao. We also have one in Zamboanga. We have a graduate who is practicing in Zamboanga. So please access these specialists. They're their best way to help you, and they're able to come up with all the solutions that you may need, and even just the support that you may need in the counseling, so that these problems will no longer be problems, and you'll probably be able to realize having your own family. Okay.
Thank you very much, Dr. Aguilar. Final words, Dr. Fernandez.
Okay, we should remember that advanced age can affect fertility, and B, both couple or both the female and the male should be evaluated at the same time. And then C, consider seeing a reproductive endocrinologist and infertility subspecialist who can help you with the treatment. And D, we should make sure that decisions are made based on evidence-based information, so that we are able to pick this up as an integral part of our decision-making process. Lastly,
Yes.
E, for everyone who lives with couples who are infertile, make sure that you are there to encourage them and to support them and not be an added source of their stress.
Thank you very much, Dr. Fernandez and Dr. Aguilar, for educating all of us on infertility. We'll see you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. Thank you for watching. This is Angel Jacob. Good night.